Are several converging consumer trends finally putting enough pressure towards getting a public health tax policy approved that's more than a decade in the making? Public health, taxes, I know what you're thinking, but I assure you that how these topics relate to the functional CPG industry is quite important. To understand this topic best, let's start at some basics around the health savings accounts known as HSAs and flexible spending accounts known as FSAs. These are tax favored accounts that permit the reimbursement of medical care expenditures as defined by a section within the Internal Revenue Code. IRC defines medical care as expenses for the diagnosis, cure, mitigation, treatment, or prevention of disease, or for the purpose of affecting any structure or function of the body. There is nuance in the IRS's interpretation of this statement, but for the purpose of this content, I want to focus on why a functional CPG category like dietary supplements aren't allowable expenses inside tax favored HSA and FSA accounts. Here's maybe the biggest problem. Have you ever turned around a supplement bottle and looked at the fine print on the label? You'll almost always see the following FDA disclaimer that's attached by the brands. This product is not intended to diagnose, treat, cure, or prevent any disease. The IRS essentially is using the FDA language to solidify its reasons as to why dietary supplements shouldn't be allowable expenses inside tax favored HSA and FSA accounts. The IRS reasons most functional foods and dietary supplements are not generally accepted as medicine and or drugs nor intended to treat a disease and are merely beneficial to an individual's good health. As such, these are considered personal expenses. In many cases, these interpretations remain appropriate. However, the FDA does approve health claims for ingredients contained in some functional foods and dietary supplements. In these cases, the products help prevent diseases in ways comparable to over the counter drugs. Additionally, some of these products also help promote weight loss and healthier lifestyles, beneficial to disease prevention. Because of these reasons, it's the belief of many stakeholders in the supplement industry that the tax code should permit these products to be permissible medical expenses under FSA and HSA rules. This is the heart of the argument that goes back more than a decade. This is when a coalition, including the American Herbal Products Association, Herbalife International, GNC, the Council for Responsible Nutrition, and several other large companies and trade organizations, began working with a bipartisan group of lawmakers to introduce legislation promoting tax parity for certain meal replacement products and dietary supplements under HSAs and FSAs. To give some additional color, I figured it would best come from someone that was there inside that coalition during that time. Here's a bit of conversation I had with a good friend, John Venardos, the former vice president of worldwide regulatory and government affairs for Herbalife International. I kind of want to go back even further than that. I want to go back to your time at Herbalife, where you had a similar kind of job title, I think, a senior vice president, and you were dealing with their worldwide regulatory, government affairs, I think industry affairs, because everybody knows Herbalife is the biggest company in the space. But why that kind of professional experience and history is important for people is that you were there from the start at where this kind of flexible spending arrangements, health savings account, and the supplement kind of is mashed up. So I wanted to kind of get your opinion on, or just kind of your recollection and you recounting kind of where this all started, maybe why it started.
Sure, Josh. Happy to. So in 2010, I was Senior VP of Worldwide Regulatory and Government Affairs at Herbalife and also had a hand in quality control, adverse event reporting developing that capability, and more importantly, probably international market expansion, getting the company into more countries around the globe. And in 2010, we hosted a fundraiser in Los Angeles for then U.S. Senator Tom Harkin, who, along with Orrin Hatch, had co sponsored the landmark Dietary Supplement Health and Education Act. And Tom said something during the course of the morning presentation that stuck with me. That is, that we as Americans don't have a healthcare system, we have a sick care system, and that we need to be able to take more control as citizens over our individual health conditions to promote health changes in terms of lifestyle changes, moderate exercise, diet, and so on. And so I was talking with Tom's staff, then Peter Reinecke, Tom's chief of staff, as well as Orrin's then chief of staff, Trish Knight. And it occurred to me that we could encourage consumers to take greater control of their health in part by allowing them to use their pre-tax dollars, which they put into company-sponsored health savings accounts or flex spending accounts. That meant that they would take money before their income taxes were deducted and put it up to the cap that was allowed by federal law into the programs. But they couldn't at that moment use those funds to purchase products such as dietary supplements or meal replacement products that were otherwise eligible for FDA approved full or qualified health claims. So, working with Sidley, the law firm, and in particular, a fellow at Sidley named Pat Morrissey, who had been on the House Ways and Means Committee staff, where the tax writing policies begin. Diane Turpin, who worked for me running the Herbalife Washington office, she and I, Sidley's Pat Morrissey, began constructing legislation. And this bill would be narrowly defined so as to only focus in on supplements and meal replacement products eligible for those health claims. The legislation was drafted. We shopped it to a number of lawmakers and got bipartisan support in the House and Senate. However, we ran into a challenge with then Democrat members of Congress who were very skeptical about opening the tax code for possible healthcare changes. You may recall this came about the same time as Obamacare was coming into play. And they did not want to open up Obamacare for any sort of legislative mischief that could deter some of the provisions that they had passed on a party line vote. Nonetheless, we had bipartisan support, also pretty broad support amongst the 5 dietary supplement trade associations and some of the other food related associations. The bill never got to a congressional hearing, which you would need to be able to advance it for possible floor consideration. So, as each session wore on after 2010, we would have it reintroduced, usually with different bipartisan supporters in the House and Senate. We would continue to go to the leadership in the Senate Finance Committee, the House Ways and Means Committee, as well as the committees of jurisdiction over the FDA. And that would be the Health, Education, and Welfare Committee. I'm sorry, that would be the Energy and Commerce Committee in the House, as well as the Health, Education, Labor, and Pension Committee in the Senate. They understood what we were trying to do. They said it would probably lead to positive outcomes. And so we decided then to work with CRN, where I was on the board of directors, to add another dimension. And that was to conduct econometric studies that would show if you had greater use of vitamin D, for example, to prevent bone fracture and hospitalization, what would be the savings and outcomes to consumers? And we looked at other nutrients as well. You can find that information on the CRN website. So that bolstered the economic persuasion that this would be positive both for the consumer, it would be positive for the government, less money being spent on healthcare interventions, and it would be good for the industry to be able to sell more products. And also keep in mind, by using pre-tax dollars, you'd be able to save up to 30% or so per product because you're not having to pay income tax on the money you're otherwise spending. The legislation continued to be introduced in succeeding Congresses, but so far, no congressional hearings have been scheduled. And without those hearings, you're not going to see any floor action.
John Venardos and I share the notion that legislation is long overdue when it comes to being able to better link FDA recognition that certain dietary supplements do have approved health claims, and these items should be similarly defined within the US tax policy as allowable tax deductions under HSAs and FSAs. It shouldn't have been difficult historically to understand why establishing tax deductibility for certain products that promote a healthy lifestyle, weight loss, or disease prevention is an important public health policy initiative. But consider how the importance has been supercharged because of the COVID-19 effect.
And it seems like it's so obvious of a a thing. You know what I mean? I think that everybody,
Yeah.
even from a decade ago, you intuitively just get it. It makes sense. But yet, for whatever reason, a decade has passed plus, and it's still kind of sitting there waiting. But there has been, and this maybe is just newer people coming in and maybe kind of digging into some of the newer kind of um, I guess, energy that's happening around the same kind of core of FSAs and HSAs. Like, do you think this time is going to be any different, or do you think that we're going to be coming up across the same thing where we're not going to get a congressional hearing and it's not going to get to that kind of point?
Well, I think there's probably two or three issues at stake here, Josh. First is we're in an election year. And in an election year, you have a limited congressional calendar, and you also have focus on what they consider must pass bills. This is not something that House and Senate leadership say is must pass. It would require extraordinary lifting by the trade associations in order to lobby Congress, in order to show that there's grassroots consumer support for such a measure. And I'm afraid, from my distant vantage point here in Kauai, I still don't see the associations collectively having sufficient legislative heft to be able to make it happen in this calendar year. Maybe down the road, yes, but not this calendar year.
Yeah, I probably agree with you on that one. I think that a lot of the I guess, excitement of it was maybe the COVID-19 effect, where a lot of people started to take maybe a more proactive approach in the
Sure.
healthcare system and wanting to be, I guess, more of a consumer in healthcare over being just a patient that was being told kind of what to do and just how important maybe all of that preventative stuff would be. And then obviously what we're dealing with in current time with inflations and all these different things, it's like everybody's looking for some type of cost effectiveness that you could help, one of your most important areas, which is, your health, and you're trying to figure that out. And it all kind of seems like it has momentum, but to your point, like I don't know if it gets there because of what we're working with in 2022. If this was all happening maybe in 2023, maybe it's a different picture where it's not really that election cycle and there's some more time.
Right. But you can use this time preceding next year in order to use the lobby days the trades have and try to set the groundwork to persuade members of Congress to look at this with an open mind, to be receptive to the benefits, and maybe perhaps dust up the econometric studies, because those are a bit dated now, to show particularly immune products and other products that lead to preventative health benefits, that there's a reason for this type of legislation.
As John and I mentioned, all of these COVID-19 effect consumer behaviors are likely helping matters, but it doesn't mean that it will happen this year. Despite that, it seems there are three proposed congressional bills that have been building up momentum, including one championed by members that serve on the House Ways and Means Committee, which helps write the tax policy. Regardless of those proposed changes to the HSA and FSA allowable medical expenses, you have to ask yourself, is it enough to create material offsets around the staggering healthcare cost increases that risk the economic and fiscal health of America and American citizens soon? You also have to ask yourself, does it advance health equity for the underserved that are struggling immensely right now? Should we be looking at a broader effort that would harmonize the way government programs treat dietary supplements? Not just the HSAs and FSAs, but for the SNAP program or the WIC government assistant participants as well. This is always the problem, though, when we're talking about government. It leaves you with a major fork in the road. Should you seek the easiest path to assure you get some positive results, or should you risk going after broader utilitarian measures but likely get hung up in red tape for years or decades? So I just kind of want to end on some quick final thoughts. While this is a tax question wrapped around a public health matter, I wish the legislative branch of the government would kind of zoom out and just try and focus on asking the hard questions around root causes that are related to obesity. It seems every time I mention obesity on social media, it gets that content kind of shadow banned. But this is one of those issues that I would happily die on that hill if I'm being honest. We are in desperate need of a comprehensive strategy to encourage healthy nutrition and to fight obesity. An extremely high percentage of all deaths in the United States are related to poor diet and physical inactivity. These are about incentivizing the right daily choices. Maybe that starts with tax deductibility for certain products that promote a healthy lifestyle, weight loss, or disease prevention, or maybe it doesn't. But we need to start thinking about improving nutrition and physical activity of the mainstream population. I hope you enjoyed this YouTube video. If you did, consider hitting that like button to support me. Also, help me get to my short term goal of 2,000 subscribers by hitting that subscribe button. I'd love to see you join me on this journey, but we need to fix the fact that slightly less than 70% of you watching this right now aren't subscribed to my channel, and that makes me extremely sad. Thank you again for tuning in, and I'll see you on the next one.